So I think really, what it comes down to is, communication, really working amongst your care team and, really, like I sort of said before, we really want to make sure that, we're making the right decision for you and, you as the patient and trying to make sure that, the medical oncologist, the radiation doctor, the urology doctor are all on the same page and we're all trying to um, do what's best for you in your specific type of situation. Definitely we want to have an open discussion of financial, social, psychological, and cultural and religious factors as well that may influence some of these decisions. And then depending on the stage of your prostate cancer, treatments vary in terms of how long they may be going on as well. So something to understand the long-term side effects of some of these treatments as well.
Yeah, and I was just add, along with the partnership, sometimes patients may seek alternative strategies and things like that. We always want to have an open discussion about, if there's an interest in taking any other kind of supplements that may not have a proven role, just so we can make sure that it's safe along with all of the other treatments that we may be recommending.
Definitely.
Yeah.
So our take-home points really are to talk to your doctor about whether or not you should get a PSA level or not, really knowing your family history. I typically tell people, I wouldn't really rely on just one PSA level. I would always repeat it really to just make sure that, it's not what we call a false positive for other reasons like we had mentioned before. Number two would be, knowing your Gleason score, the higher number, like we said, the higher risk, of the prostate cancer potentially coming back if you're going to have some type of intervention to it. Your PSA level and findings on your CAT scan will sort of guide the treatment team to make decisions. And then really discussing, with all the different doctors about all the potential available treatments and meeting with the other specialists, I think is very important because everyone will have a little bit of a different opinion. And I think it's important to hear all sides of the conversation as well.
Yeah.
And I think that's it. Any final comments that you guys have?
No, I mean, I think you covered it all. And I think, patients who are going through prostate cancer, it's a multidisciplinary process. And, we are trying to hit prostate cancer from all areas. And hopefully we can, be open, be communicative, and be the best advocates for yourself. And, your healthcare team is here to help you through it.